Thanks so much to IWGDF for the invitation to present on the offloading guidelines as part of the suite of IWGDF 2023 guidelines on behalf of the chair of the offloading group, the great Professor Seco Anthony Buss. My name is Pete Lazzarini and I am the secretary of the IWGDF offloading group, and also a podiatrist and research fellow from the Queensland University of Technology and Metro North Health in Brisbane down here in Australia. And it gives me great pleasure to really take you through the highlights of what's in the new 2023 IWGDF offloading guidelines. So before I go on, I really want to acknowledge the enormous work done by the IWGDF offloading group, which is a bit of a misnomer really, because these guys did not offload. We loaded them up with an enormous amount of work over 2 years, and you can see here there's a lot of experts from a lot of different countries, from the US, from the UK, from Europe, from India, from Australia, from a number of different disciplines, endocrinology, orthopedic surgery, podiatry, human movement sciences, prosthetics, orthotics, etc., all of which are published experts in the area of offloading interventions for people with diabetic foot ulcers. And hopefully next time for the 2027 iteration we can have a few or a bit better gender balance as well, let's say. But a huge acknowledgement to an enormous amount of work done by the offloading working group. So I'm going to rewind a little bit, ladies and gentlemen, a bit of background about why we even need to offload patients with diabetic foot ulcers, and that's because the primary cause, or the main cause of diabetic foot ulcers, is basically high isolated plantar pressure, or pressure in someone who can't feel their feet. So it's this diabetic peripheral neuropathy, particularly the sensor neuropathy, the loss of protective sensation, along with motor neuropathy, which typically accelerates gait changes and structural changes of the feet, which leads to high isolated plantar pressure in someone with no sensation in their feet, gives you a much higher chance of developing an ulcer. And we've known this for pretty much 60 or 70 years now. We've also had treatments to what we call offloading treatments to try and reduce this high isolated plantar pressure away from the wound that caused the wound in the first place, to try and effectively heal that wound. So to treat this high plantar pressure, we've had offloading interventions, like I said, for 60 or 70 years now, pretty much in 4 different categories these offloading interventions have been. The first category we call is offloading devices, and this ranges really from your more traditional total contact casts all the way down to what we call below ankle high offloading devices, which are like post-operative shoes at the end of the day. The second offloading category is footwear. That ranges from medical grade footwear or therapeutic footwear all the way down to off-the-shelf footwear has been trialled for patients with diabetic foot ulcers. The third category is a whole bunch of surgical offloading procedures ranging from digital flexor tenotomies, metatarsal head resections, Achilles tendon lengthening, surgical procedures as well. And the last category is what we call the other offloading intervention category, which is basically everything else that's been trialled, which includes things like felted foam, which has been used fairly regularly in clinical practice, gait retraining, and even Botox has been trialled as an offloading intervention for people with diabetic foot ulcers. And really what we're going to know from the guidelines is what from the research show is best when it comes to offloading interventions to not only make people with diabetic foot ulcers their feet happier, but them happier at the end of the day and not sadder. So in terms of the background or the old offloading guidelines from IWGDF, we've had offloading guidelines or offloading recommendations from IWGDF since the first iteration in 1999. We've had a specific standalone offloading guideline since 2007. The last iteration was in 2019. Here you can see, and it was based on a fairly extensive systematic review of around 160 eligible papers since the dawn of time in all things offloading interventions in people with diabetic foot ulcers. And just to remind you where we were in terms of the 2019 IWGDF offloading guideline recommendations, we've sort of cheekily come up with these offloading medalists, or the first, second and third line of offloading treatments, or gold, silver and bronze medalist. In 2019, according to the best available evidence in the IWGDF recommendations, the first line of treatment, or the gold standard recommendation, was your non-removable knee-high offloading device, be it either more traditional total contact cast or your more contemporary instant total contact cast, which is basically a cam walker or a knee-high removable cast walker made irremovable. If that was contraindicated or not tolerated by the patient, the second line or silver medalist recommendation from the 2019 IWGDF offloading guidelines was your removable knee-high offloading device or your cam walker. If that was contraindicated or not tolerated by the patient, then the third line recommended or bronze medalist offloading treatment was your ankle high removable devices. So either ankle high walker all the way down to below ankle high post-operative shoes. Now, if that was contraindicated or not tolerated, or basically if the patients or the service didn't have access to offloading devices at all, then we had a last choice or last line treatment, which was to use appropriately fitting footwear, with felted foam to offload the ulcer, but only as a last resort, and not to use footwear alone for the purposes of healing an ulcer. Now, those things didn't work in 2019, and what we meant by didn't work is haven't reduced the ulcer in size by 50% or more with other best practice treatments for people with diabetic foot ulcers. We then recommended considering a whole bunch of surgical offloading procedures, ranging from digital flexor tenotomies, metatarsal head resections, Achilles tendon lengthening, etc. So this is where we were, the snapshot in 2019, ladies and gentlemen. Fast forward to today, in 2023, the new IWGDF offloading guidelines. We've not only got a change of date, which is very exciting. You can find all the guidelines, the systematic review that sits behind the guidelines, and all the resources available for the offloading guidelines in the IWGDF guidelines website, but also the journal Diabetes Metabolism Research and Reviews. It's freely available there. As I said, the systematic review that informs the guideline is also freely available in the journal website of the Diabetes Metabolism Research and Reviews. This time you can see that we've included nearly 200 papers since the dawn of time and did over 30 meta-analyses and followed the GRADE recommendations much more rigorously this time. And GRADE is the best practice guidelines for developing guidelines, which is somewhat interesting when you think about it. And so everything is freely available there. So, to cut a very long story very, very short, what is the new highlights or the main recommendations in the 2023 IWGDF guidelines, or the 2023 offloading medalists? In terms of the gold medalist, or the first line of treatment this time, ladies and gentlemen, is again, based on the best available evidence, a non-removable knee-high offloading device. However, with a small caveat this time, for those ulcers on the lesser digits, lesser apical plantar ulcers on toes with flexible deformities, the new gold standard for those ulcers are digital flexor tenotomies based on a new high quality RCT, but only for those ulcers on the lesser apical areas of the lesser digits. If those gold standard treatments are contraindicated or not tolerated by the patient, or the patient just simply doesn't want them, the new silver medalist or second line recommendation for offloading interventions to heal people with diabetic foot ulcers is this time a tie between all the removable offloading devices, removable knee high, above ankle high and below ankle high. So any removable offloading device is your second line recommended treatments if your first line is contraindicated or not tolerated. A new recommendation this time is for anyone getting an offloading device to consider using a shoe raise on the contralateral foot, or what's often called a even up for the other foot, which has been found to increase comfort, balance and hopefully in turn adherence for patients using offloading devices. Now, for services that don't have access to any offloading devices, the last choice recommendation again is to use appropriately fitting footwear with felted foam to offload the ulcers, but not footwear alone for the purposes of healing ulcers. Yes, footwear, particularly plantar pressure guided therapeutic footwear, is great for reducing recurrence in patients with a history of ulcers, but is not better than offloading devices for healing ulcers. And if those things again haven't worked in terms of reducing the ulcer in size by 50% or more with other best practice treatment recommendations from the suite of IWGDF guidelines, then the recommendation again is to consider a whole bunch of other surgical offloading procedures such as Achilles tendon lengthening, metatarsal head resections, and joint arthroplasties. So that's, again, the headlines, the main recommendations from the 2023 offloading guidelines. Again, in 2023, we've been able to incorporate the 16 recommendations made this time in the 2023 offloading guidelines into a one-page clinical pathway, or what we cheekily often term or dub the cheat sheet, which is designed to take you from go to woe in terms of the patient presenting to you, where their ulcer is, and what's the best offloading device or intervention, I should say, according to the recommendations in the 2023 IWGDF guidelines. For example, starting with your stock standard forefoot or midfoot ulcer without infection or ischemia, it takes you down this tract of the clinical pathway. Again, your first line, your second line, and your last line of treatment that I've touched on in the last slide, with that caveat of, for those lesser digital apical ulcers, to consider the digital flexor tenotomy procedure. If those things again fail, we've suggested those whole bunch of surgical offloading procedures if the ulcer hasn't healed within 4 to 6 weeks, in terms of reduce the in size by 50% or more with other best practice treatments, to consider those other surgical offloading procedures. If your patient, however, has infection or ischemia, depending on the severity of the infection or ischemia, according to the infection and PAD guidelines, it takes you down this track. If your patient has a rear foot plantar ulcer, it takes you down this tract. If your patient has a non-plantar, which is typically a dorsal ulcer, it enables you to consider these offloading interventions. And for any patient, which will be really the majority of patients getting an offloading device, again, we suggest considering to use a shoe raise or a even up on the contralateral foot. So that's the 16 recommendations in the entirety made in the new 2023 IWGDF guidelines in a one-page pathway or cheat sheet, which we're sure most clinicians will perhaps favour rather than reading the 30-page guideline itself with all the rationale there. However, for those who do want all the detail when it comes to offloading interventions in the guidelines, the rationale, how to use the various interventions, etc., contraindications, everything you could want to know in terms of why we made the decision as the offloading group or panel for the various 16 recommendations, you can get all that detail in the guideline, which is freely available on the IWGDF website and the journal Diabetes and Metabolism Research and Reviews. If you don't like the detail, that clinical pathway, I dare say, will become your best friend when it comes to offloading treatments, which takes you from a go to woe in terms of what to use. Likewise, if you like the detail about the background to how we came up with the decision, the founding document being the new systematic review of meta-analyses that sits behind the guidelines, you can find that freely available in the journal Diabetes and Metabolism Research and Reviews. And also I'd like to point your attention to, we've got as much detail as you'd like, but also we've summarised the evidence, the best evidence available for all the various outcomes we can expect from all the various offloading interventions into a one-page cheat sheet as well in Table 4. So I'd like to turn your attention to Table 4 of the systematic review, because it summarises all the available evidence in one page for you, as the clinical pathway does of the 16 recommendations in the guideline. And with that, that's all your resources available to you in the IWGDF suite of guidelines for the offloading aspect or chapter. And with that, thank you very much for your attention, and a big, I guess, shout out again to the enormous amount of work done by the offloading panel, led by the esteemed and the great Professor Seco Anthony Buss. And with that, thank you very much for your attention.